Good afternoon and welcome to the 5th webinar in the series Putting Public Health Evidence in Action to Prevent and Control Cancer. I'm Jennifer Lehman and I'm going to be presenting on implementing the evidence-based intervention. So over the previous 4 webinars, we walked through the steps of the framework for evidence-based decision-making. And we started with engaging stakeholders there in the center of the circle and at the center of everything we do. And then we did a webinar on understanding the problem and establishing goals for improvement. We then, in webinar 3, talked about finding and selecting evidence-based interventions to meet your goals for improvement. We then talked about adapting evidence-based interventions, and today we're going to talk about implementing those evidence-based interventions into practice. Our objectives for today are to describe 6 steps to successful implementation, talk about how to assess a setting's readiness to implement an EBI, develop an implementation plan, conduct a plan, do, study, act cycle, and use communication strategies to engage key stakeholders. So let's start with a definition of implementation, and this is from the National Implementation Research Network. Implementation is a specified set of activities designed to integrate an intervention into a routine practice setting and sustain it over time. So today we're going to be talking about those activities that you can do to successfully implement your interventions. Why is implementation so important? You can have a very effective intervention and it won't impact your population's health unless it reaches the intended patients, is adopted by providers in practice settings, is implemented with fidelity, in other words, as designed, and maintained over time. So those in orange, you see the components of the Reaim Framework, which we've talked about before, which is a widely used framework. And implementation science is really focused on making sure that our interventions reach the intended patients and populations are adopted and implemented and maintained in practice. Another way of saying this is that in order to achieve positive outcomes, we need to have both effective interventions and successful implementation. So we're going to talk about 6 steps for effective implementation, and I'm going to go through each of these one at a time, starting with establishing an implementation team. So to establish an implementation team, you want to pull together 2 or 3 or maybe a few more folks in your work site who are really committed to improving the practice and are enthusiastic and willing to work together, to work on planning for how to implement the intervention, strategizing how to overcome barriers, to generate support within the practice setting and among colleagues for the EBI and its implementation, and monitoring and improving implementation over time. So to establish an implementation team, first identify one person who's going to convene the team and kind of be the champion for the work. And then identify other members of the team, and you want to look for people who have expertise and knowledge in each of the different activities required to deliver the intervention. Then agree on when the team will meet and record team progress and decisions. So in your handouts, you have an implementation team charter, which is a really helpful tool for just documenting at the start of a project what the goals are, the aims and objectives, who's going to be involved on the implementation team, where you're and when you're going to meet, who the key stakeholders are that you need to keep engaged, and your senior leadership signs this. So I'm going to walk through each of these in slightly greater depth. So at the top of your charter, you have an aim statement and measurable objectives. In webinar 2, Mary talked to us about how to establish an aim for improvement. And here you have your aim, which is to increase colorectal cancer screening rates through high quality implementation of the evidence-based FluFit program. We've talked about FluFit before, and we're going to use it as our case study for this presentation as well. You have more detailed information about FluFit in the program materials for today, but just as a reminder, FluFit is an evidence-based intervention that provides a colorectal cancer screening test or FIT test at the same time as a flu clinic. So in addition to that broad aim statement, you have some measurable objectives, and these provide specific guidance for what the implementation team is trying to accomplish and over what period of time they're trying to accomplish it. So you see here, what they're trying to accomplish is provide a FIT testing kit and recommendation to at least 80% of patients who participate in the September 2021 flu clinic and are due for colorectal cancer screening. At least 75% of patients who receive a kit will return the kit by December 30th, 2021, and 100% of patients with positive results will get follow-up diagnostic screening. So that's the charge for this implementation team. The next section of the charter establishes who the members are and what their roles are. You can see here there's a team lead, a team recorder, and then other members of the team, and then also the team meeting schedule and location. In this case, it's the second Tuesday of each month at noon in conference room 1. So at the beginning of an implementation project, you might want to meet more frequently than that. Also, over time, you may find that you need to reschedule the meeting to a different time, but it's helpful to have an established time on the calendar so that you remember to pull the team together periodically. So just going back to handout 1, the additional 2 sections are where you identify key stakeholders. Those are the people you need to keep engaged throughout the project beyond the implementation team in order for the project to be successful. And we're going to talk about that section at the end of the presentation. So I'm not going to say any more about that now. And then at the bottom of the charter, you have a place for senior leadership to sign their approval. Senior leadership support is one of the factors that really contributes to the success of an implementation project. And this charter provides a simple way to inform senior leadership of what you're planning to do, how you're planning to do it, and to get them to formally recognize and endorse your work. So the second step for effective implementation is to assess your readiness to implement. So prior to actually rolling out in an intervention, it's important to give careful thought and planning to what needs to be in place in order to have successful implementation. We suggest 2 approaches to assessing your readiness. We suggest that you first create a process flow diagram. And in the second seminar, Mary provided more detailed guidance on how to create a process flow diagram of your current process. So I'm not going to go into too much detail here, but here we're talking about making a process flow diagram of the new process that will be required to deliver this new intervention. And so at the bottom of the slide, you see an example of part of a process flow diagram. And the idea here is that you carefully think through as a team, who needs to do what to deliver the intervention. This way, you know exactly who needs to be involved, what materials they may need, and what activities they're going to need to engage in order for this to happen. Once you've completed the process flow diagram, you then can complete an organizational readiness checklist. And handout 2 that was sent for this webinar includes an organizational readiness checklist. So this is just a checklist to help you really systematically think through what you need to have in place before you launch your intervention. So the kinds of questions this checklist goes through are, does leadership support the intervention? So maybe since your leader initially signed the team charter, maybe you need to remind them that the intervention is about to be launched. 2, have we identified staff to deliver the intervention? Do we have plans for how we're going to educate and support those staff over time so that they can deliver the intervention? What space, equipment, and materials are needed? And do we have a plan for recruiting patients? So at the end of completing this organizational readiness checklist, you'll have a list of areas where there's gaps, where there's additional work that you need to do to prepare. So for example, you might identify gaps in your readiness for flu-fit program implementation. You might realize that you need to check back in with leadership and get them to again formally endorse launching the intervention. You may need to develop a plan for educating and supporting the staff that will be involved in delivering the intervention, and to develop a plan for recruiting patients. So the next step for effective implementation is to select implementation strategies. Implementation strategies is a fancy term that's used in implementation science for specific methods that can be used to prepare to implement an intervention into routine practice, and maintain an intervention over time. Handout number 3 is a list of 73 implementation strategies that are used in implementation science. I intend this list of strategies as a brainstorming document that you can use to look at, to think about new ideas possibly for what you might do to strengthen the implementation of an intervention. I also provide it because this is the ERIC taxonomy, which was created by Byron and Powell and colleagues, and is the most widely used list of implementation strategies in implementation science. So if you are partnering with implementation scientists in your work site, this gives you an overview of the kinds of language they're using when they talk about specific implementation strategies. So these are examples of some of the implementation strategies included on that handout. Change physical structure and equipment, change your medical record systems, conduct ongoing training, distribute educational materials, identify and prepare champions, remind clinicians, and the list goes on. This is an example of how those strategies might be used to address gaps in readiness for flu-fit program implementation. So if you remember, we identified a gap in that we needed to develop a plan for educating and supporting the staff who would be delivering the intervention. And so some of the strategies there include conduct an educational meeting, develop and distribute educational materials, and put a system in place to remind clinicians. So the 4th step for effective implementation is to create an implementation plan. So an implementation plan is really a formal blueprint that outlines who needs to do what, when, in order to implement the intervention. And so in developing the implementation plan, you want to review your aims and objectives, review information about the evidence-based intervention, or EBI. And so this particular evidence-based intervention is on the Evidence-Based Cancer Control Program's website, which is one of the sites we reviewed in webinar number 3. So you'd want to go to that site and make sure you have information about how this intervention needs to be delivered in order for it to be effective, and make sure your implementation plan is adhering to those recommendations with whatever adaptations you've made for your specific setting. Then review your process flow diagram, assess your readiness to implement, and consider your implementation strategies. Then you'll want to make a list of the specific tasks that need to be completed, create a timeline for when those tasks will be completed, and designate the individual who will be responsible for each task. And handout number 4 with this webinar is a template for an implementation plan. And here's an example of part of a template for the implementation plan for FluFit. So you see actions are broken up by pre-implementation, and then implementation, and then sustainment would be an additional part of your implementation plan. Here, I'm just providing a part of the plan, primarily the pre-implementation steps. So here you can see the actions, and the first action there is create system to flag patients due for screening in the electronic health record. And that needs to be done by April 2021, and IT is responsible for doing it. The second action is purchase the FIT testing kits, and you see due date and person responsible. Develop and pilot test FIT kit instructional materials, date and person responsible. And the actions continue, providing you a detailed plan for what you need to do to move forward, and when and who's responsible to effectively implement this intervention. So the next step for effective implementation is to conduct Plan, Do, Study, Act cycles, or PDSA cycles. So this, a PDSA cycle is a small test of small changes to implementation. So you can conduct these prior to implementing your intervention or while you're implementing your intervention. And the goal here is to plan for really small, feasible, simple tests that you can do in a short period of time to just understand what's working well and what's not, and make improvements over time. And handout number 5 is a template for developing Plan, Do, Study, Act cycles. The reason for using PDSA cycles is it helps adapt good ideas to your specific situation. It forces you to think small, and this is important. If you try to make them too large, then they're overwhelming and you're less likely to do them. But if you think small and make it something that can be done fairly simply, then you can do multiple PDSA cycles to continuously study and improve the implementation of your interventions. It forces us to be methodical and make predictions and learn, and allows for rapid adaptation and implementation of changes. So this is a kind of a silly example, but it's just to give you an idea of what we mean by a PDSA cycle. And so in this case, the problem that we're trying to solve is that we keep getting to work late, and it's just a recurring problem. And so we decide to test a simple solution to see if it will improve our timeliness at arriving to work. And the simple solution is to lay out our clothes the night before. And so we do this for a very short time frame. It's not an elaborate study, it's a small, simple study. And so we try laying out our clothes for 1 week. And we also come up with a simple way to study it. And in this case, we decide for 1 week before we put this change in place, we'll keep track of what time we arrive at work. And then we'll keep track of what time we arrive at work for 1 week after we make this change. And then if it got us to work earlier, we put it into practice permanently and always lay out our clothes the night before. And So maybe we're getting to work earlier, but we're still not quite on time. So then we would think of another simple change that we could try and put into practice. Again, following the Plan, Do, Study, Act format. So the idea here is that you repeat these cycles over time to progressively improve your implementation. So PDSA cycles, as I've said, can be done pre-implementation or during implementation and sustainment. And so this is an example of how you might do a PDSA cycle prior to implementing your flu FOBT intervention. And so in this case, it's going to be really important for your intervention success that you have test kit instructional materials that your patients understand and can use to correctly collect a stool sample. So highlighted in orange there is develop and pilot test fit kit instructional materials. And so that's something you can pilot with a PDSA cycle. And so this is how you might do that. So plan what you will pilot. In this case, you've developed a one-page sheet designed for low literacy, and you're coupling it with very brief instructions on how to complete the fit test. And so prior to doing the flu fit clinic, you might ask one of your providers if you can pilot test this one-page instructional sheet on one of their patients who's due for colorectal cancer screening, or one or two of their patients. And so you work with that provider, and after the provider recommends that the patient get colorectal cancer screening, that provider sends the patient to you, and you sit down, and with that patient, you review, you ask them to review the one-page sheet, and you give them brief explanation, and then you ask the patient to teach back, to tell you what they're going to do to complete their fit kit, to see if they understood the guidance. And if they do, and you do this with a couple of patients, then you have your one-page instruction sheet. But if they didn't understand, and when they teach back, they are not correct in the way to complete the fit test, then you need to improve your one-pager and test it again. So PDSA cycles can also be used during implementation and maintenance. It's important as you're implementing an intervention to identify gaps and look for small solutions to those gaps. For example, on the first day of your flu fit clinic, you might monitor how many of the eligible patients you identified that come for the flu clinic actually leave with a fit test. And in doing so, you might find that you're missing about 25% of the patients that come in. You then pull together your little team and kind of problem solve and think about why is that and what solution can we try tomorrow to see if we can increase the percentage of eligible patients coming in for the flu clinic who receive a fit kit. And then you could test it out in a PDSA cycle. And see in the next day if it works or not, the improvement that you've planned. So I'm going to introduce another framework from implementation science. This is perhaps the most widely used framework in implementation science. And it's a framework that helps you think about the potential causes of your gaps in implementation. So this framework could help you think widely about the factors that may help to explain why only 75% of patients are getting the fit kit when they come in for the flu clinic, or any other kind of a gap in implementation. Again, I introduce this to you as a brainstorming tool. Do not limit yourself to the factors on this list. It just helps you think broadly about the kinds of factors you may need to target with your implementation planning and strategies. I also introduce it to you so that you'll be familiar with one of the most widely used frameworks in implementation science. So we have an activity for you. Retrieve handout 6, which is a list of the CFR, which is short for Consolidated Framework for Implementation Research Constructs. And then we have the flu fit case study is handout number 7, which you can refer to if needed. What I'd like you to do is brainstorm factors that might be barriers or facilitators to implementing flu fit, and try to identify at least one factor within each of the 5 CFR domains. I suggest you stop this webinar to do this activity and then resume the webinar when you're completed. All right, so here are some examples of potential barriers that are included in the CFR, or Consolidated Framework for Implementation Research, and I've listed at least one in each of the domains. So for intervention characteristics, the source of the intervention can be a barrier or a facilitator. So in the case of the flu fit program, if people in your setting perceive this as something that was created by people outside of their setting that they don't even know, they may have distrust for the intervention and not fully endorse it. And so that would be an intervention source barrier. Outer setting patient needs and resources are a central factor in the outer setting. And so you may be working with a patient population that is working 2 jobs, raising children, is completely overwhelmed. And taking a fit kit home with them and remembering to complete it in a timely fashion and getting it back into the mail so that it goes to the lab may be too many steps for them to follow and complete, given the overwhelming nature of their lives. And you may, for some patients, need to come up with an alternative plan. One plan is to have them complete the flu fit within the clinic if they're able. They may not be able to, but if they're able, to complete it while they're still at the clinic, and give it to a staff person to take and mail. Inner setting, relative priority is a factor within the inner setting. So this is when you're trying to do the flu fit clinic, and at the same time, several other initiatives are being launched, and your flu fit initiative takes a lower priority to those other initiatives, and there's very little steam or enthusiasm left to implement your intervention. Characteristics of individuals is the 4th domain, and one characteristic of individuals is knowledge of the intervention. Does the staff in the clinic even know about your flu fit intervention program? Do they understand how it works and what their role is? And if not, that can be a real barrier. The final domain is the process domain, and that really looks at how the intervention was implemented into practice. And so 2 pieces of that. One is the planning. Did you do adequate planning ahead of time? If not, that can be a barrier. And are you engaging the appropriate stakeholders and other staff and leadership to support the intervention? So once you've identified gaps in implementation, again, revisit your implementation strategies list. And this is the same sample of strategies that I showed you earlier. And again, you have in your handout that list of 73 potential strategies that you can draw from. Don't limit yourself to those strategies. That's just a brainstorming support. You can move beyond that if you have other ideas. But as you identify factors that are barriers to implementation as you're implementing an intervention, think about ways to overcome those barriers. All right, the last step for effective implementation that we're going to talk about today is communicating with key stakeholders. And I think this is an area where we don't do a good enough job. It's very common for a lot of energy to go into an intervention initially, and then for people to shift their energy elsewhere and not keep stakeholders engaged and informed of what's going on over time. We all, and the folks you're working with in your work site, are like that bright orange square in the middle there. We all have way too much on our plates to do all the time, and it's easy for us to shift our attention away from the implementation of an intervention. And so you need to keep your stakeholders engaged and informed over time. And this is key, particularly to preventing what's called program drift. And this is a really common in implementing interventions, and it's when energy and attention shifts to the next new intervention or the latest crisis, and the quality of intervention delivery diminishes over time. So who are the key stakeholders for your Flu-Fit program that you need to communicate with and keep engaged over time? You want to make sure you're communicating with leadership and ensuring that they continue to promote and support your intervention. You also want to communicate and engage healthcare providers who will refer and reinforce your program, and your coworkers who will assist with Flu-Fit implementation and delivery. You also want to communicate with your patients. So there are a whole range of strategies you can use to communicate with stakeholders. And I always encourage making sure you go for the feasible, easily doable ones first. And then if you have energy, go for the higher intensity strategies. So some examples are, you can schedule a one-to-one meeting. So this might be something you do with your key leadership and just say, I'd like to just take a few minutes to update you on what's going on with our intervention. You can post intervention on a bulletin board that's visible to staff in your practice area. People will often put up something that they progressively change to demonstrate the increase in the number of patients that have been reached or increase in outcomes over time, so folks can readily see the success of the intervention and will remain invested. You can include an article in your organization's newsletter, create a flyer, present a brief report at a staff meeting, and I think this is a great approach, is just ask to be included for 3 to 5 minutes on every monthly agenda, and make sure you're really succinct, but plan for a succinct update on how well things are going and what you need other staff to do to continue to support the intervention. Higher intensity efforts gain media coverage or post to social media. So that is the 6 steps to implementation. I want to draw your attention to the final webinar, where Kam Ascafri is going to present on how to evaluate the impact of your interventions.